Do you think you know everything about blood pressure? Think again. Top 20 common blood pressure myths. Myth number 1. High blood pressure always has symptoms. Fact. High blood pressure often has no symptoms, which is why it's called the silent killer. Myth number 2. Only older people get high blood pressure. Fact. High blood pressure can affect people of all ages, even children. Myth number 3. Stress is the only cause of high blood pressure. Fact. While stress can contribute, other factors like genetics, diet, and lifestyle also play a role. Myth number 4. Once treated, high blood pressure is cured. Fact. High blood pressure is usually a lifelong condition that requires ongoing management. Myth number 5. Over-the-counter medications can effectively lower blood pressure. Fact. Some over-the-counter medications may have a temporary effect, but prescription medications are usually necessary for long-term management. Myth number 6. Losing weight is the only way to lower blood pressure. Fact. While weight loss can be beneficial, other lifestyle changes like diet, exercise, and stress management are also important. Myth number 7. All types of exercise are good for lowering blood pressure. Fact. Intense exercise can temporarily raise blood pressure. Moderate intensity exercise like brisk walking or swimming is generally recommended. Myth number 8. Avoiding salt completely is the key to lowering blood pressure. Fact. Moderate salt intake is generally recommended, but everyone's needs are different. Myth number 9. Alcohol consumption always raises blood pressure. Fact. Moderate alcohol consumption may have minimal or no effect on blood pressure for some people. Myth number 10. Herbal remedies can effectively lower blood pressure. Fact. Some herbal remedies may have a slight effect on blood pressure, but their effectiveness and safety can vary. Myth number 11. High blood pressure only affects adults. Fact. Children and adolescents can also develop high blood pressure. Myth number 12. White coat syndrome is not a real condition. Fact. White coat syndrome is a real condition where blood pressure readings are higher in a medical setting due to anxiety. Myth number 13. Home blood pressure monitors are inaccurate. Fact. Home blood pressure monitors can be accurate when used correctly and regularly calibrated. Myth number 14. High blood pressure only affects the heart. Fact. High blood pressure can damage various organs, including the kidneys, brain, and eyes. Myth number 15. Once blood pressure is under control, medications can be stopped. Fact. In most cases, blood pressure medication needs to be taken long-term to maintain control. Myth number 16. Stress management techniques are ineffective for lowering blood pressure. Fact. Techniques like yoga, meditation, and deep breathing can help reduce stress and lower blood pressure. Myth number 17. All people with high blood pressure need medication. Fact. Lifestyle changes alone may be sufficient for some people with mild high blood pressure. Myth number 18. High blood pressure is only a problem for older adults. Fact. High blood pressure can develop at any age and increase the risk of serious health problems later in life. Myth number 19. Smoking only affects the lungs. Fact. Smoking is a major risk factor for high blood pressure and can significantly increase the risk of heart disease and stroke. Myth number 20. High blood pressure is always caused by an underlying medical condition. Fact. In many cases, the cause of high blood pressure is unknown. How many of the myths do you know? Comment us.